And in working with states, you all advocate on behalf of health insurance requirements. But there are some people who would say that that's one of the reasons why insurance coverage and then perhaps treatment as well is so expensive. So how do you find a middle ground on requirements that would actually get people the care that they needed, but then also not driving up costs?
I think there has to be a candid adult discussion about rational care and how the current money is being spent that's in the system, because there is a tremendous amount of money in the system now that could be spent better. And then on the heels of that, we have to talk about prevention and health promotion. The very things that most health insurance plans don't pay for are the things that are relatively inexpensive and highly, highly, highly effective. So if we can turn on those issues, and there's no reason that we can't, then we can get away from, as test by test state mandate. But there needs to be a rational discussion about what does a basic health care plan need to look like that's in the best interest of all American citizens. I mean, we haven't yet leveraged our strengths, which is that we are a country where well over 90% of all people are born healthy, and then something goes wrong. We now have the knowledge of knowing how to keep healthy people healthy for a normal human lifespan, but we have to make sure that our health care system offers that and gives people access to that knowledge and to those technologies.
Now, the society is looking at this through what they call the cancer lens.
Mm-hmm.
But can you talk about how making improvements for people with cancer will actually improve the system overall for everyone?
Yes, I certainly can. We were the first organization ever in the history of the voluntary health organization movement, disease-specific societies, to step beyond just the cancer piece and say, we call for access to quality health care for everyone. The reason for that is that we did careful studies and found out that there are three major things that have to happen for us to bring cancer under control as a major public health problem early in this new century. And of those three, one, access to quality care was the only one that can keep us from ever getting there. So we said, let's go to the American public and show them the broken healthcare system through the cancer lens. So real people, not actors and actresses, but people who called our call center who had cancer and didn't have coverage, we recorded it and shared it with the American public. And everyone who sees it says, that's not right. If you have a cancer diagnosis, you should be able to get the care you need. We hope that then when that's fixed, a rising tide raises all ships. It will improve the outlook for not just cancer, but for heart disease, diabetes, and many other diseases.
Now, just last week, you all launched the Fight Back Express bus. Can you talk about that, what the campaign is, what you all have learned from it so far, and what you hope to achieve?
Absolutely, Jill. The Fight Back Express bus was launched just a week ago in Cleveland, Ohio. We'll go 25,000 miles. We'll visit all 48 of the lower contiguous states before Election Day. And community events are being held as I speak and every day hereafter. And the notion is to inform people that we can save more lives from cancer than ever before. 500,000 people were saved over the last 15 years because people had access to things. But we can double and redouble that number if all people have access to quality health care. There's no reason in this country, arguably the richest country in the world, that we can't take the money in the system and deploy it in such a way that everybody has a chance of either not having cancer in the first instance, 60% of all cancer is preventable during a normal human lifespan, or detecting it early when it is most treatable and the outcome is the best. Cancer is potentially the most preventable and the most curable of the major life-threatening diseases facing Americans today, and we think the bus and our efforts will help change that potentiality into a reality for everyone.
Now, the end of the tour is going to be here in Washington, D.C. on Election Day. So looking forward to 2009, how hopeful are you that there is enough momentum for actual change in our healthcare system?
We're very optimistic. I think we certainly are not naive and don't take anything for granted, but we can see the excitement that's already been generated. We have good data after our paid media campaign that shows that people are really getting frustrated and are very, very worried for themselves and for their families. So we think that every serious candidate is going to need to stand up and speak out about what he or she would do about this problem. And then we're in a position, the American Cancer Society, with our new Cancer Action Network, a 501c4 organization, to remind them after elected what they said and hold them accountable.
Great. Well, Dr. John Seffrin, CEO of the American Cancer Society, thanks again for joining us on health08.org today.
You're welcome. Glad to do it.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.